Hey guys, what's up? Let's do something. Okay, so right now we'll be answering questions on this section of the NCLEX. They want you to understand how to attend to emergencies, casualties, and disaster. You work in a hospital setting. You should be ready to receive calls. Maybe there's a mass accident happening somewhere on the highway. They call you, they inform you, the emergency team informs you that about 50 persons have been involved in an accident. You have to act. Okay, you're in a hospital, there's a fire incident in one department, you have to know how to act. So the guy wants you to understand this area that happens in a hospital setting very often. So let's see the first question here. It says, when entering a client's room, the nurse observes smoke coming from a piece of client care equipment. What is a priority nursing intervention? A, immediately remove the equipment. B, obtain the appropriate fire extinguisher. C, unplug the equipment. D, remove the client from the room. Which is the right answer? The right answer is D, remove the client from the room. You might be thinking the right thing to do is to first of all unplug the equipment. If you've not done fire safety course, you might not understand. However, the Nclex wants you to know this. Those who have done fire safety course, you will know what we call the RACE and the PASS, the acronyms. Now, this question, you can still relate it to other questions like the patient is on ventilator and you get a high alarm in the patient's room, you get in. What thing should you do next? The first thing, when you get in, your eyes should focus on the patient, not the equipment. Okay. Patient safety first. Attend to the patient before the equipment. So let's revise something here. Let's move to the next slide and I show you something. Now, there are acronyms that you have to use. How to use the fire extinguisher, you apply pass, pull, aim at the base, squeeze, and sweep from side to side. Now, when it comes to uh, safety, like attending to those involved, you follow what they call RACE. RACE means rescue, okay? You saw the first question? Rescue. Rescue means remove whosoever is involved in the incident from the scene. A is alarm. So you have to pull the fire alarm. Where you're working in your units and your facility is supposed to know where the fire alarm is. You go pull. So of course, they want you to remove those involved first before you pull. Remember, when you pull the lifts and everything closed, okay, all the lifts in the facility are closed when the fire alarm is pulled. Okay. Next is contain. Contain means you have to close the doors, you have to close the windows, okay? Then E, extinguish. That is where now you grab the fire extinguisher and then you apply pass, pull, aim at the base, squeeze, and sweep from side to side. Take a pen and paper, copy this, and then you practice. You have questions that come. Please apply this. Don't attend to by unplugging the equipment first. Now, if it happens, they will give a scenario, okay? So there's a fire incident and the patient has been removed from the scene. What will you do next? You must follow this, okay? It means rescue has been attended to. R has been attended to. The next thing will be for you to pull the nearest fire alarm and not to contain. So okay, you would think, okay, I've removed the patient from the scene. Let me just go ahead and close the doors and the window. Follow RACE. Follow RACE. Okay. Now let's go back and see. The second question says, the medical center encounters a bomb threat. The emergency response team informs the staff that the threat is legitimate and that clients should be evacuated. Which clients should the nurse begin evacuation first to the safe designated area? Okay, A, ambulatory clients, B, bedridden clients, C, intensive care unit clients, D, pediatric clients. The answer is A, ambulatory clients. Why? Because ambulatory clients, they are mobile, okay? They might be moving to the direction where the bomb is taking place. Also, you can easily direct them. They are mobile. You can easily direct them to a safe destination. Before attending to those who are bedridden, you have to pull the bed, those who are on ventilators, and so on. So these are the two reasons in this situation you attend to ambulatory clients first. Now let's revise fire disaster or disasters in general. There are internal disasters and external disasters. Internal disasters occur in a facility, right? Workplace fire, structural collapse, radiation pills. External disaster could be mass accidents, tornadoes, hurricanes. In the US, the emergency response team, what you have to know, you have to activate the emergency response team or the plan whenever you are informed by the EMS that there is a disaster and they are bringing in victims. Why on the community, those involved, you always have the American Red Cross members, the team there to rescue. So if you're in a community and you are the first responder on the scene, what will you do next or which hotline will you call? They will put a list of hotlines. So you should call the American Red Cross hotline. So you as the nurse, you have to undergo some training, the mock drills, the bomb threats, and how to activate the shooter drills. So we've revised that. Let's move on. The third question. Several clients have come to the emergency department after a possible bioterrorist act of arsenic overexposure. The nurse should assess the client for which signs or symptoms immediately following the poisoning. Select all that apply. This is a SETA question. A, violent vomiting. B, severe diarrhea. D, sensory neuropathy. E, persistent cough. So which ones are signs and symptoms of arsenic exposure? We have A, B, C. Okay, violent vomiting, severe diarrhea, abdominal pain. Sensory neuropathy occurs after the acute phase. It tells you immediately following the exposure. Now let's revise. What is arsenic? It's a chemical, okay? It's a chemical, it's a metalloid, it's a poison. Most people use it to commit suicide. This poison can also be found on groundwaters or waves. So when you are exposed, it can be eliminated from your body as quickly as possible, but some can still accumulate in your hands, in your nails, in your hairs. So when it happens, like say you touch it with your hands and you ingested it, and a team comes in to do a criminal investigation, what they call forensic study, they have steps to follow. So they will be checking to see if they can find these chemicals on your hair and your hands. So when you are first exposed, immediately you will feel these signs and symptoms, violent vomiting, severe diarrhea, abdominal pain. But sensory neuropathy comes in after the acute phase. So what is forensic study? You might have seen some questions, and you as a nurse, there are things you have to do. Okay, so forensic study is collection of specimen for evidence in crime scene, right? Like exposure to blood, arsenic, like what we've said, body fluid, carbon monoxide, So the purpose, your own role is to make sure that this specimen is preserved for evidence. Like somebody touches a gun, uses a gun, and the patient is brought to the hospital. So what happened is that the gun, the bullet, or whatsoever should be wrapped in a gauze and put in a cup or envelope. Okay? Which whatsoever evidence that they want to use, whether it is gravel, it is soil, it is grass, is whatsoever, you must preserve it for transportation so that the team involved should come and carry out their investigation. Do not cut through if the clothing, maybe some spills. They advise that you don't cut through or disrupt the tears or holes or blood stains or dirt on the cloth. Do not interrupt. Okay? So you place this cloth and whatsoever on the paper bags. Place on the paper bags. So if the victim comes, you can, grab the hand, to preserve the specimen. Or you carefully remove the cloth and place it in a paper bag. Do not place it on a plastic bag because the plastic bag might produce a moisture that might destroy the evidence, that might damage the evidence. You might have seen some questions and they ask you select all that apply. These are answers I've collected from several questions. Take notes. Okay? If there's any evidence in the pocket, you should collect every item, everything from the victim and preserve. If it is a swab, a dry swab, or a moist secretion, whatsoever, you should air dry them prior to placing them in the container or in the paper bag. Air dry. Okay? So along the line, still provide confidentiality, okay? And the healthcare provider and you obtain consent before carrying out the investigation. So this is what I want you to know as far as forensic study is concerned. There are questions, I've seen a lot of questions from this area. Let's look at the next question. Question 4, excuse me. 30 people are injured, excuse me. 30 people are injured in a train derailment. Which client should be transported to the hospital first? Yes, I told you. Let's see. A 20-year-old who is unresponsive and has a high injury to his spinal cord. B, an 80-year-old who has a compound fracture of the arm. C, a 10-year-old with a laceration on his leg. D, 25-year-old with a sunken chest wound. Which is the right option? The right option is D. Okay? During a disaster, the nurse must make difficult decisions about which persons to treat first, right? So the client with a sunken chest wound needs immediate attention and will likely survive. Back to what I told you. In this type of accident, let me show you the slide. Let's look here. No priority, the last level. Disease, extensive injuries that cannot be treated, unresponsive, unconscious, high spinal cord injury. During mass casualty incidents, you don't attend this patient, their rate of survival is very low. Okay? So you might be looking at unresponsive and has a high injury on the spinal cord. No, you don't attend to this patient, you attend last. You attend last. The patient with a sunken chest wound is having a cardiac situation which can be attended to and can be revived as quickly as possible, right? The 80-year-old is classified as delayed. So emergency response personnel can immobilize the fracture and cover the wound. Yeah. The 10-year-old, what happened? That's minimal injuries, can wait and be treated later. Like I said, a client with a spinal cord injury is not likely to survive and should not be among the first to be transported to the healthcare facility. So you must understand when you're answering this question. The question comes to the emergency department following the triage system is different. During mass casualties, the resources are few. The personnel are not there. You are trying to transport them to the facility. So you attend to those whom you can revive first. Okay, let's look at the next question. 32 children are brought to the emergency department after a school bus accident. 2 children were killed along with the 3 people in the car that caused the crash. Before the victims arrive, in addition to ensuring that the hospital staff are prepared for the emergency, which steps should the nurse anticipate carrying out? Good. This is a very good question. A, calling the nearest crisis response team. B, alerting the news media. C, notifying the hospital volunteer office. D, calling the school to inform teachers of the accident. A is the right answer. Remember I said during an incident in the hospital, the first thing to do is to activate the emergency response plan or the emergency response team. So you get everything ready before the MS team, they bring the victims, okay? That's what you have to do. That is what you have to do. Should I let you do question 6? Do question 6. Post your answer in the comment section. I will respond. The nurse is triaging victims of an earthquake who were removed from a building when the earthquake occurred. Which of the following victims should be classified as red? Yes, we saw it during prioritization. We've seen it now, and this is a question for you. Okay? This one is for you. Bye-bye, and see me in my next video.